useful if, in fact, it was the Leader's deputy that made that statement.
Leader of the House.
Mr. Speaker, I apologise to my honourable friend. There was some problem with the technology. He was kindly helping my argument that technology is not the answer to every possible problem, and that sometimes good old-fashioned turning up in person is helpful. But I got the broad impression that my honourable friend isn't very pleased. But I do wish to correct the record that my honourable friend, the member for Pudsey, did not undertake to go round to see the Prime Minister and tell him what my honourable friend wanted him to say. I think he probably, had he answered the question in greater length, but he was under pressure of time, would have said that he was going to go around to Downing Street, tell the Prime Minister what a wonderful job he's doing and how lucky we are to have such inspired leadership, which I hope my honourable friend would concur with. However, I can assure him there will be a debate. There is a debate scheduled on the continuation of the Coronavirus Act 2020 provisions on Wednesday the 30th of September, and that will be the opportunity for these points to be raised.
Kevin Bratton.
Thank you, Mr. Speaker. Parents held vigils around the UK yesterday, including my constituent Rachel Rankmore, whose son Bailey Williams has very severe epilepsy, and they were holding those vigils because they're still paying thousands of pounds in private prescriptions to get hold of medical cannabis. Now, in Northern Ireland, apparently the administration is helping financially. Can we have a debate about why that's not happening in the rest of the UK?
Mr. Speaker, there is always a great sadness in children who are suffering from these very difficult conditions, and questions as to what drugs are made available and who pays for them. Obviously, there is a responsibility from NICE to investigate that, but I'll happily pass his comments on to the Secretary of State.
Thank you, Mr. Speaker, and my right honourable friend will not be surprised to hear that the incompetently run Lib Dem Council in Sutton is once again not listening to Carshalton and Wallington residents, this time in relation to road schemes which are causing traffic chaos across the borough. So I wonder if we can have a debate in this place about these road schemes and about the way that council should be consulting with residents properly.
Mr. Speaker, my honourable friend's right. The Lib Dems hate the motorist, of course, and want to make life as difficult as possible for motorists whenever they can. And the Emergency Active Travel Fund on the 9th of May was £225 million of funding in 2 tranches for local authorities. But the local authorities have the responsibility for how that money is spent. But the government will ensure that if they don't demonstrate that the money spent is providing improvements, the funding will be withheld.
Speaker, it is estimated that around 320,000 private renters have fallen into rent arrears during this pandemic. Many have lost work, fallen through gaps in support, or struggled on reduced earnings on furlough. On Sunday, the evictions ban ends, putting hundreds of thousands at risk of eviction and tens of thousands at risk of homelessness. So for private renters in Coventry South and across the country, will the Leader of the House give government time to urgently discuss measures to stop this crisis, such as extending the evictions ban for at least a year, scrapping no-fault evictions as promised in the Tory manifesto, and cancelling rent arrears?
Mr. Speaker, nearly £1 billion of support has been provided for renters, increasing the generosity of housing benefit and universal credit, so that the local housing allowance covers at least 30% of market rents in local areas. Measures ensuring no tenant has been forced out do indeed come to an end on the 20th of September, but landlords have not been able to evict for the last 6 months, and there is a balance to be struck between landlords and tenants, and the government has, as I say, spent a great deal of taxpayers' money trying to support tenants.
Earlier this summer, I spent time campaigning to get my constituency in Erdby and Wigston out of our local lockdown, and nobody wants to go back into those kind of measures. But unfortunately, the number of coronavirus cases, particularly in Erdby, has gone dramatically up. I've told the Health Secretary that any new measures must be extremely well targeted and proportionate so that they don't affect people's businesses and livelihoods. But can we have a debate on how we best handle local restrictive measures?
Mr. Speaker, my honourable friend raised a very important point. It is important that restrictions are precise and aimed at the areas most at risk. Local outbreaks do require local action and may be a feature of our lives for some time to come, but the government's aim is to enable as many people as possible to live their lives as close to normal as possible. And he will have the opportunity, I hope, depending on the call list, to quiz the Secretary of State for Health in a moment.
Let's head to Lewisham with Vicky Foxcroft. Vicky Foxcroft.
Thank you, Mr. Speaker. On July the 16th, the Youth Violence Commission, which I chair, launched its final report and recommendations. I sent a copy to all members and peers the following week. Will the Leader of the House ensure that the Prime Minister has read the report? And will he grant us a debate on youth violence so that we can discuss these urgent recommendations and hear the Prime Minister's response?
Mr. Speaker, obviously youth violence is a very important point, and I congratulate the Honourable Lady on bringing it to the attention of the House and for the work that she has done. I think it's very suitable for a backbench business debate. I imagine it would have considerable support across the House for that. I think it would be bold of me to tell the Prime Minister what he ought to read, but I will certainly ensure that the copy that she sent to him has arrived.
We now go over to Crawley with Henry Smith.
Mr. Speaker, thank you very much. For over half a century and throughout all parts of the United Kingdom, our historic counties have been divided, merged, replaced and abolished, as my right honourable friend, the Leader of the House, will know only too well with his beloved Somerset. Can we have a statement, please, from the Cabinet Office on respecting our traditional counties, perhaps via the Lord Lieutenancies?
Mr. Speaker, the Lieutenancies Act of 1997 does set out that the ceremonial counties will be the historic counties, and it was a rather splendid act because it reunited Somerset and other historic counties which had been boulderised by Ted Heath's administration. I think the historic counties are a very important element of British history, which support the identity and cultures of many of our local communities, giving people a sense of belonging, pride and community spirit. And I hope that the counties will be recognised, though as I am addressing an honourable friend from Sussex, it's worth reminding him that the conversion of Sussex to Christianity was delayed because the woodland was so thick that it was hard for the converters to get through. But I am glad that he stands up for his county.
Marvellous. Can we just speed up because I'm worried we're not going to get everybody in. Patrick Grady.
Thank you, Mr. Speaker. I don't know how familiar the Leader of the House is with the concept of no recourse to public funds, but it means that one of my constituents has been left close to destitution while caring for her grandchildren after their mother died of cancer because she can't get her status sorted with the Home Office. Can he arrange for a minister to look into this specific case, and can we have a debate on the wider issue so that a minister can come to the dispatch box and explain how this government continues to justify its inhumane, hostile environment immigration policy?
Mr. Speaker, the honourable gentleman is absolutely right to raise a constituency issue of this kind on the floor of the House, and I will certainly take it up with the Home Office and ensure that he gets an answer.
26 withdrawn, so good to Judith Cummins.
Thank you, Mr. Speaker. I welcome the sentencing white paper that the Justice Secretary introduced yesterday, as it restates the government's commitment to increase the maximum sentence for causing death by dangerous driving to life imprisonment. But it is now nearly 3 years since the government first announced this change. Families waiting for justice have waited long enough. So can the Leader of the House tell us exactly when this legislation will be introduced to give bereaved families the justice they deserve?
Mr. Speaker, may I thank the Honourable Lady for the campaigning she's done on this very important issue and her success in developing policy on this in this area, because I think it is her influence, her questioning, that has helped the government come to its policy decision, which you will have known the Lord Chancellor announced yesterday. As regards the precise timing of the bill, I can't give an absolute answer as to the day it will take place, but the White Paper sets out a serious government priority which will be introduced as soon as parliamentary time allows and the bill has itself been written. That is the not too distant future. So I hope that answer is at least encouraging.
Pauline Latham.
Mr. Speaker, given that the Prime Minister yesterday refused to rule out changes to the 2002 International Development Act, could we have a debate in this chamber about the implications of that for international development assistance for the poorest people in the world, and who in this House will actually be scrutinising what is happening? Good question.
Mr. Speaker, the House decides how to set up its own scrutiny, and select committees are a matter for the House, and the scrutiny will continue as it currently is, I believe, until the end of the year, and then the House will have to come to a decision.
Thank you, Mr. Speaker. Mr. Speaker, tomorrow I will be announcing my Angel Awards, recognising the people, organisations, businesses and public bodies that have done so much to support our communities across Blaydon in the coronavirus pandemic. So will the Leader of the House now join me in thanking all of those people who have done so much, and will the government bring forward a scheme to recognise those people across the country who have gone above and beyond to support their communities?
Well, first of all, can I thank the Honourable Lady for her absolutely marvellous initiative. I think it is so important that we thank people and recognise the incredible outpouring of community spirit that there has been during a very difficult time. She's doing absolutely the right thing, and it seems to me that if the government can piggyback on the work that she has been doing, that is not a foolish thing to do. So I will certainly bring it to the attention of other ministers.
30 withdrawn. Jeff Smith.
Thank you. Mr. Speaker, every year in England, over 100,000 people in problem debt attempt to take their own lives. Now, we know it's complex and there are a range of factors that lead to somebody who's in debt becoming suicidal. But research shows that one key factor is the intimidating letters they receive from lenders. And it's a real concern with millions more people facing debt as a result of the crisis. So will the Leader of the House encourage the Chancellor to make a statement outlining how we make provisions for a small change to the rules contained in the Consumer Credit Act on the content of debt letters in order to simplify the language and signpost people to advice? I understand it can be done quite simply by statutory instrument and it could save lives.
The honourable gentleman raises an important point that should concern the whole House. There is a great deal of support available from organisations across the country for people who are in debt that they cannot afford to repay. And the ability of debt counsellors to help debt be rescheduled and to help lift the burden from people is there. I agree with the honourable gentleman. It would be very helpful if this were more widely known. And I know that all of us as constituency MPs do sometimes point our constituents in this direction. I understand the point he's making about changing the wording. Letters sent out by debt collectors ought not to be threatening. That is quite clear. And I understand his point, and I'll pass it on to the Chancellor.
Diana Davison.
Thank you, Mr. Speaker. I was delighted to see the government launch a task force to reopen Hammersmith Bridge here in London, the closure of which has been a congestion nightmare for hard-working Londoners. But as part of the levelling up agenda, which is at the heart of this government, we need to bridge the gap between London and some of our left-behind communities. So on that note, will my right honourable friend ensure me that the government displays the same strength up north in reopening the Walton Bridge in my constituency, which has cut off communities and has been closed now for over a year?
Mr. Speaker, I understand the Walton Bridge was built in 1831, so a year before the Great Reform Bill. No, I wasn't here at the time. And it is a fine example of 19th century engineering. And the Right Honourable Lady says I'm a fine example of 19th century engineering. I'm not quite sure that's entirely true, but I'll take it as a compliment. But this is the responsibility of Durham County Council, and they ought to listen to my honourable friend. Bridges connect communities and ought to be repaired.
Thank you, Mr. Speaker. Scotland is a dynamic, forward-looking nation and is ambitious to retake its position on the world stage and do so by adherence to the international rules-based order, and when it makes an agreement with a future ally, it will stick to it. Contrast that with the way that this government is behaving this week with the UK Internal Market Bill and its ambitions to break international law. Will the leader agree with me that the Scottish Government would be perfectly within its rights to, in seeking a Section 30 order in preparation for our upcoming referendum, should one not be forthcoming, we'll just decide to carry on regardless?
Mr. Speaker, there is an incongruity in the honourable gentleman's comment. He says, quite rightly, that Scotland is a forward-looking, fine, upstanding nation. But then he wants to kowtow out of the European Union and take Scotland's fish and give them all away to the fisher folk of the European Union. So he can't have it both ways. Either he maintains his pride in Scotland, shared with the whole of the United Kingdom, or else he wants to go and be a vassal of the European Union.
Dean Russell.
Mr. Speaker, in my constituency in Watford, we have a local landmark which is on a road called Woodmere Avenue, but it's all for the wrong reasons. As cars navigate through it, they get scratched, and residents feel like they're between a rock and a hard place, or between a post and a scratched car. in the sense that local bureaucracy and back and forth over many years has meant that local residents have not been able to get this changed. Can we please have a debate to look at how we can unwrap local issues around bureaucracy so we don't keep going through a Groundhog Day of residents requesting change, having to do petitions, try and get change, and then it not happening? Can we please get pavement politics back into government? Thank you.
Mr. Speaker, my honourable friend's absolutely right, and we really need to discourage councils from their war against the motorist. We should be backing the motorist. Driving is a great sign of one's independence, liberty, and an exercise of historic freedoms. But local authorities are quite rightly independent. So the answer is campaign to get in a Conservative council.
The Court of Appeal ruled that the government's periodic assessment regulations for universal credit are illegal, and the next day the Minister for Welfare Delivery said that they will now begin the process of carefully considering possible solutions. But 3 months and several written questions and an EDM later, there has been no update. Now, Mr. Speaker, tens of thousands of people are affected by this, and one of my constituents has continually had her passported benefits wrongly taken away because of this problem. Devastating at any time, but especially during COVID. So will the Leader of the House therefore speak to the Minister for Welfare Delivery and encourage him to come before this House and provide a meaningful update on the government's plans?
Mr. Speaker, when court cases don't go the government's way, it is obviously right that things are considered very carefully. But it is worth saying that there has been a £9 billion worth of support for the universal credit following the coronavirus crisis. An enormous number of people have received extra support during that period, and the government has been making the money available to ensure that that happens. But it is only right that when there are court judgments, they are examined carefully.
36 withdrawn. Justin Mathers.
Mr. Speaker, in common with many members, I'm having trouble getting timely responses to written questions from many government departments. I've got about 30 outstanding at the moment, some of which are more than 3 months old. One in particular, though, will be of interest to all members, which is in relation to preparations for Remembrance Sunday. All legions up and down the country beginning to think about what we can do to have a COVID-secure Remembrance Sunday. So can we have a statement, please, from the relevant minister as a matter of priority?
Mr. Speaker, I'm grateful to the honourable gentleman raising this point of timely ministerial responses. I will confess that I put in an envelope letters outstanding to one ministry from April, May, June and July in the hope that I might get a reply to them. If I don't get a reply in due course, I will tell you which ministry it is, but at the moment I think I will keep that quiet. Remembrance Sunday is one of the great important national days. I've absolutely heard what he said, and I will take it up with the relevant Secretary of State.
I'm sure my honourable friend will agree with me that our negotiating position has been strengthened as a result of the Internal Market Bill passing its second reading. That said, if the European Union continues to act in bad faith, the government must be prepared for an orderly departure with or without a deal. So can the Leader of the House confirm that the government has made all the necessary preparations if an agreement is not reached next month?
Mr. Speaker, my honourable friend is absolutely right in what he says about the UKIN bill strengthening our hand. We left with a deal in January, and planning for the end of the transition period is well underway, coordinated by the EXO Cabinet Committee, to make sure that we are ready to seize the great opportunities of being outside the single market and the customs union. With the Internal Market Bill going through Parliament, I can assure my honourable friend the government will have full legal ability to maintain the sovereignty of our nation and the integrity of our internal market. We have launched a comprehensive communication campaign to make sure people and businesses know what they need to do to prepare for the end of the transition period, and that remains a central priority of the government and departments.
Let's head to Scotland with Peter Grant. Peter Grant.
Thank you, Mr. Speaker. Can I first of all correct the Leader of the House in his assertion, which he repeated again this morning, that those of us who are working from home are somehow not at work? That'll certainly be news to my wonderful constituency team, who dealt with a fourfold increase in casework this year without having to set foot in our office. The Leader says he wants Parliament to be a safe place for people to work. He must know that some members of parliament are making it a more dangerous place by deliberately flouting safe distancing requirements in the chamber, in the voting queues and elsewhere. What steps is he taking to make sure that all MPs set a good example by complying with health and safety requirements in the House and by being polite to members of staff whose job it is to help keep everybody safe?
Mr. Speaker, the honourable gentleman's very, very last point is of very, very fundamental importance. And Mr. Speaker, both you and I have made it clear to all the staff at this House, and particularly to the doorkeepers and the security people, that they are allowed to ask members, remind members, and all other people on the estate of the need to maintain social distancing. And it would be quite wrong for any member to be high-handed when asked to remember the requirements of social distancing. I think one shouldn't be too critical because inevitably, human nature being what it is, things will not always be perfect. But the work that has been done to make this a COVID-secure workplace is terrific. There are markings on the floor, things are spaced out, the seats in the chamber have been limited to ensure we are COVID safe. And perhaps I should say to the honourable gentleman, he might like to come down and see how well it's working.
Fiona Bruce.
Does the leader share concerns about the safety of women following accounts of serious medical complications after some women have taken abortion pills at home, as is temporarily allowed during this pandemic? And shouldn't we therefore be looking to revert back as soon as possible to confidential in-person consultations being available for all women before such serious procedures are undertaken?
Leader of the House.
Mr. Speaker, my honourable friend is absolutely right to raise this deeply troubling issue, and it is important that safeguards that used to be in place are put back in place as soon as possible. I think of course, anything to do with abortion is not a matter where the government has a policy, so it is a matter for one's own private conscience, but the honourable lady knows that her conscience and my conscience align on this matter.
In order to allow the safe exit of honourable members participating in this item of business and the safe arrival of those participating in the next, I'm suspending the House for 3 minutes. Order! Are you ready? Get yourself online. You ready? John?
Yes.
Order. I call the Secretary of State for Health, Matt Hancock.
Thank you very much, Mr. Speaker. And with permission, I'd like to make a statement on coronavirus and about our plans to put us in the strongest possible position for this winter. Like many other countries around the world, we're continuing to see a concerning rise in cases, with 3,991 new cases recorded yesterday. And this week, the number of patients in mechanical ventilator beds has risen above 100 for the first time since July. The battle against coronavirus is not over. And while we strain every sinew to spring free of its clutches, with winter on the horizon, we must prepare, bolster our defences, and come together once again against this common foe. One of our vital lines of defence has been taking targeted action at a local level. We've seen local action work well in some parts of the country, and now we must take further action. Mr. Speaker, we've seen concerning rates of infection in parts of the northeast. Sunderland, for example, now has an incidence rate of 103 positive cases per 100,000 population. And in South Tyneside, Gateshead and Newcastle, the figures are all above 70. As a result, local authorities wrote to me earlier this week asking for tighter restrictions, and we've taken swift action to put them in place. From tomorrow, in Northumberland, North Tyneside, South Tyneside, Newcastle upon Tyne, Gateshead, Sunderland and County Durham, residents should not socialise with other people outside their own households or support bubble. Hospitality for food and drink will be restricted to table service only, and late night restrictions of operating hours will be introduced, so leisure and entertainment venues must close between 10 p.m. and 5 a.m. Mr. Speaker, I know, the whole House knows, that these decisions have a real impact on families, on businesses and on local communities. And I can tell everyone affected that we do not take these decisions lightly. We agree with the local councils that we must follow the data and act, and the data says that we must act now, so we can control the virus and keep people safe. And I know that the people of the North East will come together to defeat this virus, as defeat it we must. Mr. Speaker, we're working to bolster our health and care system too. Winter is always a stretching time for health and for care, but this winter presents particular challenges. People will be spending more time indoors than in the summer, where we know that the virus is more likely to spread. And we know that we will need to deal with coronavirus along with the usual pressures that season will bring. So today I want to set out our plans to support the NHS and social care this winter. Turning first to the NHS, I can tell the House that we've allocated a further £2.7 billion to the NHS to support it during winter months. This funding, in addition to the extra funding for PPE and testing, will help the NHS with the vital task of operating safely in a world in which COVID is still at large. And the task, which is critical, of working through the backlog of elective work that was inevitably caused by the first peak. Mr. Speaker, our emergency departments are on the front line of the fight for life in the NHS. Today I'm delighted to announce a series of measures to support our urgent and emergency care system this winter and beyond. And I want to thank and pay tribute to Catherine Henderson, the President of the Royal College of Emergency Care, with whom I've worked closely to develop these proposals. I want to thank her, and through her, all of those who work in emergency care for their service in the face of adversity. I saw this again this morning at St Thomas's Hospital A&E, and I know that all of us support the work of those who work in our emergency care facilities right across the country. And I very much hope that yours, Mr. Speaker, will be opening soon in Chorley. Mr. Speaker, we will make our emergency departments bigger. Many are simply too small. This was true even before the pandemic, but it's even more acute now. So we're investing to expand capacity in urgent and emergency care so hospitals have the space to continue treating patients safely in the coming months. In August, we confirmed £300 million for emergency upgrades across 117 trusts, and I can today go further and announce £150 million to expand 25 more emergency departments, including some of the most constrained in the country, like Worcester and the Royal Shrewsbury. This extra funding will put us in the strongest possible position for this winter and boost the crucial work to accelerate non-COVID care. Mr. Speaker, it's not just about the space, but about the service. So we're working to get patients the right care in the right place by expanding the role of NHS 111. During the peak of this pandemic, we saw millions of people using NHS 111 on the phone or online to get the best possible advice on coronavirus, helping them to stay safe and, where possible, stay out of hospital, where they could have unknowingly spread the virus. It's crucial that ahead of winter, we use this window of opportunity to seek out what worked and build on it so we provide a better service for patients and protect the NHS. Of course, no one will ever be turned away from our emergency departments in the most serious of cases. However, we've worked with the Royal Colleges, with the NHS and others to develop a better, quicker and more clinically appropriate service for patients by using NHS 111 first. How it works is this. We'll invest £24 million to increase call handling capacity and to make sure that there are more clinicians on hand to provide expert advice and guidance. And we'll build on our trials to make NHS 111 a gateway to the emergency care system, providing a first port of call for patients. So in future, rather than having to queue in an emergency ward, we're testing that people should call NHS 111 first to book an appointment with whoever can give them the most appropriate care. Whether it's a GP, a specialist consultant, a pharmacist, a nurse, or community services. And of course, if they need to go to the emergency department, then NHS 111 will be able to book them into an appropriate time slot. We want to see this approach lead to shorter waiting times and better availability of appointments for patients. We'll consult on how its performance is best measured, and with successful pilots, we'll roll out NHS 111 first to all trusts from December. Finally, Mr. Speaker, I wanted briefly to update the House on our work to protect care homes. One of the worst things that we know about this virus is that it reserves its greatest impact for those who are physically weakest, especially the elderly. And so we must do everything in our power to protect residents in social care. In May, we introduced the Adult Social Care Infection Control Fund, which has helped adult social care providers to reduce the rate of transmission. This was used to fund important measures like improving infection prevention and paying staff to self-isolate. And I can now inform the House that we will extend this fund for 6 months and provide over £540 million of extra funding for providers. This brings our total funding for infection control measures in social care to over £1 billion, and we'll also shortly be bringing forward our adult social care winter plan, because we'll do whatever is humanly possible to protect our care homes from this virus so that they're a place of sanctuary this winter. Mr. Speaker, we'll soon be facing winter in this fight, and whether it's on our NHS emergency care wards or in our care homes, we'll strain every sinew to give them what they need so they're well equipped for this pandemic and indeed for the years ahead. And I commend this statement to the House.
Shadow Secretary of State Jonathan Ashworth to reply.
Mr. Speaker, and thank you to the Secretary of State for advance sight of his remarks. The capital investment for 25 A&Es will be welcome. And on the piloting of the 111 to triage ahead of A&E, given inequalities in accessing healthcare for the poorest and disadvantaged, how will he ensure this doesn't worsen health inequalities? And if this leads to greater demands on primary care, will GPs be given extra resources as a consequence? The NHS is facing a likely second spike, winter pressures and a monumental backlog in non-COVID care. The Chancellor promised to give the NHS, quote, whatever it needs. Does that promise still stand? And will the NHS get the funding it now needs to tackle the growing backlog in non-COVID care? On social care, can he guarantee care homes won't face the same shortages of PPE that they faced at the start of the pandemic? And does he accept that restrictions on family visits causes huge harm to residents? Does he rule out reimposing nationwide restrictions on family visits? On testing, Secretary of State said little about testing this afternoon, Mr. Speaker. Back in May, he stood at the dispatch box and told this House that everyone aged 5 and over with symptoms is now eligible for a test. Anyone with a continuous cough, a high temperature, a loss of change in their sense of smell can book a test. We have, in his words, now got testing for all. Yet 4 months later, for the British people, it has become not so much test and trace, more like trace a test. At just the point when many fear we're on the cusp of a second deadly spike, the Prime Minister admits we don't have enough capacity. And rather than fixing testing, the Secretary of State is restricting testing. In the exchanges on Tuesday, 33 members from across the House raised issues around testing in their constituencies. He responded with the local figures. It was a very good debating trick. Well done to the Special Advisor for producing the briefing. But it will be no comfort to our constituents who are advised to travel hundreds of miles for a test when ill. It's no comfort to parents with a poorly child, themselves sick with worry, unable to get a test. It's no comfort to those who were turned away from walk-in centres and now are presenting at A&E asking for a test. It's no comfort to the 25,000 teaching staff who are not in schools teaching our children because they can't get a test. What people want to know is when this Secretary of State will fix testing and deliver on his promise that testing is available to everyone. Now, the Minister of State on the media this morning said there will be priorities for testing. So can he outline what his rationing plans are? Care England says weekly testing of all care home staff is still not happening. Will care home staff get testing under his imminent rationing plan? And what about people living in areas of restrictions, including the North East? Will the North East get all the mobile testing sites that they request? And what is happening in university towns with thousands of students set to come to universities across the country in the next 2 weeks? Will there be extra testing in those areas? And in July, he pledged 150,000 asymptomatic tests per day by September. Has that commitment now been abandoned? But, Mr. Speaker, we shouldn't be in this mess. We warned him that without fixing testing and isolation, that infections will rise. And rather than increasing capacity over summer, Pillar 1 and Pillar 2 lab capacity remained broadly flat. He's now setting up more commercial lighthouse labs, but why not invest in the 44 NHS labs instead? And there are still problems in these commercial labs, aren't there? There's a huge number of voided tests across the commercial labs. Randox had 35,000 voided tests across August. And today's stats show test turnaround times, again for testing in these labs, getting longer. Serco is still failing to trace 80% of contacts. At what point will he step in and strip poor-performing outsourcing firms of their lucrative public sector contracts? Now, Mr. Speaker, when testing breaks down, case finding breaks down, isolation breaks down, and we lose control of this virus. The British people made great sacrifices. They missed family celebrations. They couldn't say their final goodbyes to loved one at funerals. But the British people honoured their side of the bargain. In return, the government was supposed to deliver effective testing and tracing. The government failed. And now we have vast swathes of the country under restrictions. Where do we go next? The Prime Minister yesterday said a second lockdown would be disastrous. Obviously, we all want to avoid a second lockdown. But the British public deserves some clarity. Is he completely ruling out a second, short, national lockdown in all circumstances? Infections are rising at pace, but it's not clear what the actual strategy of the government now is. It's all very well talking about camel humps and moonshots We need a plan to fully suppress this virus. It's urgent that he fixes testing, fixes tracing, gives people isolation support to avoid further restrictions. Otherwise, we face a very bleak winter indeed.
Thank you very much, Mr. Speaker. Madam Deputy Speaker, to respond to the constructive questions that the honourable gentleman raised, I welcome his comments on the use of 111 First. The purpose of 111 First is indeed to improve access in terms of inequalities in the NHS by ensuring that people get the right treatment in the right place and easier access if they do need to go to an emergency department, because the emergency department will know that they're coming. It's commonplace now in almost every part of our life to let people know if you're coming. And if you're going to do something as important as visit an emergency department, it will help both the patients seeking treatment and the NHS to let them know that you're coming first. That's the principle behind 111 First, which of course sits alongside 999 that anybody should call in any serious incident. He asked about the need for extra funding for the NHS, both for winter and for testing. I've just announced £2.7 billion of extra funding for the NHS, and I thought that he might have done rather better to have welcomed it. He talked about tackling the backlog of cases that inevitably built up in the first peak. The good news is that we are making progress in tackling that backlog and reducing the backlog. Of course, there's an awful lot of work to do, and that is part of what this extra funding will go towards, alongside the funding to expand our emergency departments and the funding for PPE and, of course, the funding for testing that I mentioned in my statement. He asked about PPE for care homes. We have a huge plan to ensure that care homes can get PPE, and the details will be set out shortly in the social care winter plan. And he asked about family visits. Now, the challenge of visits to those living in care homes is, of course, an incredibly difficult one, because nobody wants to spread coronavirus, yet also we need to make sure that those who live in care homes get the support that they need and that they deserve. He asks about testing, and of course there's a challenge in testing. The central point is that capacity, contrary to what he said, capacity is at record levels and has increased week on week. The challenge is that demand has gone up faster. And they can say on the other side, no, it's not, but they can't defy the facts. And the most important thing for everybody across the country to hear from all of their elected representatives, if they are interested in helping this country get through this pandemic, is that if you have symptoms, get a test. If you don't have symptoms, please do not come forward to get a test unless you're specifically asked. That is what colleagues on all sides of the House need to be repeating to their constituents, because I come to then the point of prioritisation, which he rightly raised. And he raised I like him, and he raised exactly the right point. And the right point is this: we choose to prioritise care home staff and care home residents. Over 100,000 tests a day of the 260,000 capacity are sent to care homes. We could solve other problems by not doing that, but we prioritise those who live in care homes because that's the right thing to do. He asked about areas where there's restrictions. We prioritise putting tests into areas of restrictions, like Leicester, where there were over 1,000 tests yesterday. And this is the core point. When something is provided for free and demand is therefore high, we have to prioritise where we put our national resources. So I actually, his tone on prioritisation was almost at the point of welcoming it, and welcome it he should. He also asked about universities, and it is important to prioritise testing where that's clinically appropriate for universities too. Finally, he asked about the recent today's contact tracing figures, and again he played this divisive card which doesn't suit him at all. talking about the difference between the NHS and the private contractors. What I care about is a good service for the people who we serve. And the figures announced today, Madam Deputy Speaker, are that 83.9% of contacts where communication details were given have been reached and told to self-isolate. That is the contact tracing working to help, even as the numbers of cases go up, to help to control this virus. So what I look forward to as we approach winter, Madam Deputy Speaker, is the two sides of this House coming together in the national interest, not playing these divisive cards that will simply play against the interests of those who we serve, who elect us here in order to take our country through difficult times.
Chair of the Health Select Committee, Jeremy Hunt.
Thank you, Madam Deputy Speaker. Today is World Patient Safety Day, which I had the privilege of launching virtually with Dr. Tedros of the World Health Organization this morning. And the changes the Health Secretary is announcing to A&Es are about patient safety, because as Dr. Catherine Henderson told the Select Committee, if we go back to crowded A&E waiting rooms, patients will die. So I welcome these changes, but can I ask him specifically about sepsis? Because our A&Es have made huge progress in testing people who need to be tested quickly for sepsis when they arrive at A&Es. If this is now going to be done on the phone, if that's the first point of contact, it is absolutely vital that 111 call handlers are properly trained and their algorithms adjusted to make sure we ask the right questions on sepsis. So could he undertake to do that?
I wholeheartedly support the points that my right honourable friend has made. I pay tribute to him, to his work in establishing World Patient Day, and to thank him for his ongoing work in the international arena, representing our country, but driving forward this agenda globally. I entirely agree with him on his comments about 111 first. It's absolutely critical that both the online and the phone systems act to ensure that sepsis is recognised wherever that is feasibly possible, to make sure that people get the best and the safest route to care. I will ensure that the point that he makes is registered. We've put in the extra funding that I just announced that goes into 111 in order to ensure there is more clinical support when people access the service through NHS 111 first. Indeed, I pay tribute to my right honourable friend for introducing 111 in the first place. There's an awful lot of work to do here, but it undoubtedly will help patients get a better service and help the NHS deal with all the multitude of cases that come its way.
We now go to the SNP spokesperson, Dr. Philippa Whitford.
Thank you very much, Madam Deputy Speaker. While personal behaviour and local measures are critical, so is a functioning test, trace and isolate system. Last week, the Prime Minister claimed there was capacity for 350,000 COVID tests per day. But I'm sure the Secretary of State is well aware that a third of that capacity is antibody testing, which only becomes positive after the infection and is therefore of little use in diagnosing cases or managing outbreaks. So why has the government not published the daily diagnostic testing capacity since last Thursday? He has promised there will be 500,000 diagnostic tests a day by the end of next month. So can he confirm this definitely refers to diagnostic antigen testing? And is he confident it will be delivered on time? The current problem is a shortage of laboratory capacity, with the government now cutting test appointments in many parts of the UK. Does he accept that that causes a danger of new outbreaks not being detected at an early enough stage? With the rationing of test slots, there are multiple reports of people being advised to enter an Aberdeen postcode to obtain authorisation for a test, even though the test will be carried out in the south of England. Does he accept this will undermine Scotland's contact tracing system and that incorrect data could give the false impression of a local outbreak in Scotland which doesn't exist? How does he plan to stop this practice? And finally, the Secretary of State has previously talked about his moonshot testing project, based on millions of people testing themselves for COVID every morning. Can he clarify if he's planning such tests to be provided on the NHS, or would individuals be paying for them? And if on the NHS, given the enormous price tag and the fact that technology doesn't even exist yet, shouldn't he focus funding and effort on getting the current diagnostic testing system working in the here and now?
Thank you very much, Madam Deputy Speaker. Taking the points in reverse order, of course investing in the next generation of technologies is important here and now, because if you don't push forward with the next generation of technologies that can allow you to expand testing, then you'll always be stuck with the current one. The idea that there's a dichotomy between the two is completely wrong. The point she makes about an Aberdeen postcode, we already have in place a system to ensure that if you put in a postcode that is not where you're going, then if you turn up at the wrong drive-through centre, then that will be indicated to the people at the drive-through centre. So that problem has been resolved, indeed had been resolved before it was first raised in this House. I just hope that, like the Scottish Government, she will reiterate the point that people should come forward when they have symptoms or have been told to by a public health professional, and not come forward if they do not have symptoms. And working together across the UK is undoubtedly the best and only way to solve this crisis to the benefit of all of our constituents. And that brings me to the point about testing in Scotland. There are more tests in Scotland through the drive-through centres, through local testing sites, through the mobile testing centres, than there are in the rest of the UK per head of population. So we over-index the number of tests through those routes that we put into Scotland. And indeed in the Scottish NHS, there is spare capacity which needs to be used. And I'm working very closely with the Scottish Government to ensure that the spare capacity there is in the Scottish NHS is used, given the enormous demand for tests right across this country. And I think that that tone of working together is what we need to see.
Robert Larkin.
Thank you, Madam Deputy Speaker. Earlier this month, Tameside and Glossop CCG was reporting the highest COVID death rates of anywhere in the country. Can I put on record my thanks to Ministers, Public Health England and NHS staff for working very hard to try and tackle this worrying situation. But it is very concerning that my constituents are still being asked to travel sometimes over 150 miles away to get a test. Can the Secretary of State reassure me that the government is doing everything it can to ramp up testing and laboratory capacity as a matter of urgency?
Yes, of course, and of course there are challenges that we're working incredibly hard to address, both in Derbyshire and nearby in Greater Manchester. Now, across Derbyshire as a whole, in the last week, there have been almost 4,000 tests done. So the testing capacity is there. The challenge is that there's also this increase in demand, and we have to make sure that the people who are getting the tests that are available are the people who need them most. That's the principle behind prioritisation, and it's a principle that everybody here should support.
Helen Hayes.
Thank you, Madam Deputy Speaker. A constituent wrote to me yesterday, "My child started at primary school last week. Inevitably, she's picked up a cold. That cold includes a slight temperature. She's not allowed back to school until she's had a negative COVID test result, nor are my wife and I allowed to go to work. No tests are available." This scenario is being repeated in thousands of households across the country, with children who've already been out of school for 6 months facing further weeks at home because they cannot get a test. The heroic efforts of teachers to enable the full reopening of schools are being undermined by the chaos of the testing system. When, Madam Deputy Speaker, will school children, teachers and support staff have reliable, rapid access to testing and results so that COVID cases can be swiftly identified and isolated and disruption to education minimised?
Well, yes, these are the challenges that we're working so hard to address, and there are, of course, the message to her constituent and indeed others is that there are thousands of tests available in her part of London. And it is incredibly important that those with symptoms come forward, but that those who do not have symptoms do not. I know that her constituent that she mentioned had symptoms. The critical thing is that everybody, all of us, have the same message. Those with symptoms do come forward, but those without symptoms do not, because it's that huge spike in demand that is the challenge, and it's as simple as that.
Lucy Allen. Thank you, Madam Deputy Speaker. Testing capacity is a finite resource, and it's right to consider prioritising care homes, hospitals and key workers. Will my right honourable friend ask his department to also consider the issue of testing very young children? This age group frequently experiences raised temperatures, coughs, colds, and some parents are taking very young children for multiple tests when those children in that age group are unlikely to be out in the community spreading the virus. People want to do the right thing. Nobody wants to overwhelm the system. So will he continue to do all that he can to ensure that the system of testing is operating efficiently?
Yes, I thank my honourable friend for that question, which captures the challenges that we face. Because it is absolutely true that children under the age of 16 are very, very unlikely to get ill with coronavirus. And indeed, the test positivity, the proportion of under 16s testing positive is extremely low and is flat, whereas it's rising in many other age groups. So she raises a point very clearly. The prioritisation that we have is about getting the tests that we have, record capacity, but we're getting those tests to the people who need them most, and that's why it's an important principle.
Lillian Greenwood.
Thank you, Madam Deputy Speaker. Over the next few days, tens of thousands of students will be arriving in Nottingham, and our universities have spent months planning for a safe return, but there's a real danger that their hard work will be undermined, as Nottingham School's incredible efforts have been undermined by the inability to get tests and results promptly. The University of Nottingham has repeatedly requested access to a small stock of pre-distributed Pillar 2 swab test kits, which would enable faster and safer testing for symptomatic students and take the pressure off local community testing facilities. Will he work with and listen to universities like the University of Nottingham to help improve the efficiency of the national testing programme? And will he authorise the allocation of these kits to the university and others who request them?
Well, I'll absolutely look into this. This is exactly the approach that we've taken with schools. Many universities' labs are an important part of getting test results back as well. So I'm very happy to work with all of the 106 universities who are doing so much to make sure that the return of university is COVID secure, and I'll look into the precise points you raised.
Elliot Coleman.
Thank you, Madam Deputy Speaker. And I've also had a number of Carshalton and Wallington residents get in touch with me about testing, some being sent down to the south coast to places like Portsmouth and Southampton. So can I ask my right honourable friend what more the government is doing to ensure drive-through centres like those in Chesington, which is very nearby, are being able to continue to process these test sites, but also bring in more testing capacity into boroughs like Sutton?
Yes, we're looking to get more testing capacity right across the board, as he well knows. And the Chesington drive-through centre, which was one of the first that we put in place, has done an amazing job over the entirety of this pandemic. The good news is, as I mentioned to the House on Tuesday, that the average distance people have to go to get a test, as the crow flies, has fallen from over 6 to under 6 miles. And so, the message is there are thousands of tests available. The average distance is low. And the critical thing is the people who come forward to get a test are the people who are eligible for a test, not people who don't have symptoms.
We now go to Stella Creasy.
Thank you, Madam Deputy Speaker. There are multiple private companies involved in running the track and test system. Serco, McKinsey's, Deloitte, Randox, to name but a few. Can the Secretary of State tell us if there is a financial penalty written into their contracts for when citizens cannot get tests and what that penalty is? Or is it only our constituents who will pay the price for this mess?
It's the task of the companies that she mentions and many more, and of the British Armed Forces, and of the NHS, and of the Department, and of Public Health England, and of many, many local councils, including her own, to get as much capacity as possible. That's what their job is, and they are doing that in record levels.
Peter Alders.
Thank you very much, Madam Deputy Speaker. The feedback which I'm receiving from local schools is that the problems that staff and pupils are experiencing in getting tests could make it very difficult for some schools to remain open. To prevent this, can my right honourable friend firstly liaise with the Secretary of State for Education to ensure that clear guidance is provided to schools about when to request a test? And secondly, can he do all that he can to ensure that local testing programmes, such as that provided by the Norfolk and Waverley Clinical Commission Group, continue to operate as they do provide much needed additional capacity?
Yes, I agree with both points made by my honourable friend.
Jim Shannon.
Deputy Speaker, the Secretary of State has announced some £2.7 billion extra for the NHS. Can I seek confirmation that under the Barnett Consequential, how much of that will come to Northern Ireland? The news of the progress of a vaccine is a very positive step. Will the Secretary of State again confirm that no vaccine will be available on the NHS that has not been rigorously and completely tested? And with that assurance, will the Secretary of State outline if he considers that children and education as a priority for the vaccine?
Thank you very much. On the NHS funding, the Barnett Consequentials will operate in the normal way for his constituents in Northern Ireland and right across the country. When it comes to the question of the vaccine, of course, we will only allow a vaccine to be put in place across the board when it is safe, and the MHRA is one of the most respected and high quality regulators in the entire world. It's they who will make the decision on whether it's safe to license. And of course, the question of who should be vaccinated and in what order is again a clinical decision on which we'll take advice from the Joint Committee on Vaccinations and Immunisation.
We now go to Dame Cheryl Gillan.
Thank you, Madam Deputy Speaker. Can I thank the Secretary of State on behalf of myself and my colleagues in Aylesbury and Buckingham with the extra A&E funding for Stoke Mandeville. It will make a great difference to patients and our valued NHS personnel in the Buckinghamshire Health Trust. But can I just say that in my constituency, in common with other members, I am having a problem with the education system. A head teacher has written to me saying we now have teachers and teachers' children with COVID symptoms, which means they're off in isolation. And they're being told that there are no tests available for 21 days. She writes, "This is very tricky as we have to pay a lot for supply teachers to cover classes. Would it not be sensible to prioritise testing for teachers if it's a priority to keep schools open? As once too many teachers are off waiting for tests, schools will have to close and then people won't be able to return to work." What does the Secretary of State say that I can tell my head teacher, and how can we get those tests into schools more rapidly to mitigate these problems that are coming down the line?
Yes, Madam Deputy Speaker, the Right Honourable Lady raises several important points. Firstly, Stoke Mandeville Hospital is a famous and excellent hospital, and I'm delighted that we're able to expand its emergency facilities in this way, and she has done more than anyone to represent the needs of Stoke Mandeville Hospital and all those who serve in that great hospital. And so I welcome her comments on that. On testing, absolutely, we've sent tests to all schools to make sure that they have tests available. But I also recognise the challenges, of course, in getting hold of tests. I do not accept at all that there's a delay of 21 days, and nobody should accept that. That is not government policy. I've just looked up the figures, and across Buckinghamshire, just over 1,000 people a day are getting tests. So the tests are There are tests available. This is part of the challenge of having the record capacity, but demand having gone up. I'm working as hard as I can to make sure that all those who need a test, who have those symptoms, get a test. But of course, if people do not have symptoms, even if a close contact has symptoms, I understand that it's a very human instinct to think that therefore the best thing is to get a test if a close contact has symptoms. But if you don't have symptoms, please do not come forward and use a test that is needed for somebody who has symptoms, so that either they can get a negative result and get back to their normal lives like teaching at a school, or of course if they test positive, that we can give them the treatment and support that they need.
I do want to be able to get everybody in, so I would urge colleagues to make the questions fairly brief and correspondingly the answers. Munira Wilson.
Thank you, Madam Deputy Speaker. Whilst there are some welcome announcements in this statement, I am utterly astounded that there is only one reference to coronavirus testing in this statement, when we see cases rising across the country, a system in meltdown, people unable to access tests, turnaround times down. If he doesn't believe us, perhaps he should read his own constituency inbox. So will the Secretary of State finally admit the system is broken, we risk losing control of the virus, and will he issue a public apology?
Madam Deputy Speaker, the Honourable Lady earlier in the week, in a statement that was all about testing, raised an issue which turned out to be wrong, and actually I think it's really important. I just want to say this. I think it's really important and incumbent on all of us as public servants to explain things fairly and straight and properly to our constituents, and that's what she should start to do.
Ray Tracy.
Madam Deputy Speaker, and can I thank the Secretary of State for that statement. And I'd actually been due to head to the North East myself this weekend to celebrate my parents' golden wedding anniversary, which obviously can't do now, but I would like to take this opportunity, if I can, to wish them a happy anniversary anyway. Just on the subject of testing, I have been contacted by constituents who are really struggling to get tested, and I know this is something the Secretary of State really does grasp and appreciate, but I wonder what further reassurances he can give them that those who genuinely do need testing will be able to access them as soon as possible.
I'm sure that my own friend's family will be disappointed that he won't be there, but at least a mention in Hansard is something to make up for it. But of course, he raises he rightly raises the challenges in terms of getting tests. What I can assure him is that we are working as hard as we possibly can to fix the problem, that tests are available even though it's a challenge to get hold of them, and that those who do have symptoms should come forward and get a test.
We now go to Clive Betts.
Thank you, Madam Deputy Speaker. 2 weeks ago, residents in Darnley, my constituency, were pleased that a new walk-in test centre was going to be opened. They're now being told not merely can't they walk into that test centre, but they can't walk or drive into any other local centre. Across the city, Sheffield Teaching Hospitals Trust has done a brilliant job in using its own laboratories to process tests for staff and patients since the beginning of the COVID crisis. Will the Secretary of State now answer the question posed by my honourable friend from the front bench and indicate when he's going to fully use the capacity of public sector laboratories to fill in for the failures of the private sector to perform the contracts they've been given?
Madam Deputy Speaker, first up, we absolutely support the Pillar 2 testing, as it's called, which in Sheffield has delivered over 10,000 tests in the last week. And I think that he, normally such a reasonable man, should welcome that and thank all those who work on that project, whilst also absolutely I support his proposal to further expand the NHS testing in Sheffield. And I look forward to working with the NHS in Sheffield to doing just that.
Dr. Ben Spence.
Thank you, Madam Deputy Speaker. It is absolutely right that we put in now provisions to prepare for winter. And so, will my right honourable friend join me in welcoming the announcement of £6 million for expanding St Peter's Hospital Accident and Emergency Urgent Care Centre, and the huge difference it will make both to patients but also staff working in our hospital?
Well, absolutely. This is one of the 25 projects that we're announcing today, all about preparing for winter. There is nobody who stands up for Runnymede in this house more than my honourable friend, and he's made a great case for his local hospital, and I'm very glad to be able to support it today.
Yvette Cooper.
Thank you, Madam Deputy Speaker. A constituent of mine has her husband, who works in the NHS, her husband came home on Friday with COVID symptoms. She has been trying to get him a test ever since, getting up at 5 a.m. in the morning to try and do so, being told there's tests available locally, and then being told actually no there aren't and she can't get one. She's since developed symptoms herself. Neither of them have been tested. Neither of them are therefore in the tracing system, so there's no follow-up to prevent other people getting the virus as well. This isn't just chaotic, it is dangerous. The government knew there would be a huge increase in demand for testing when the schools went back and when it was encouraging people to go back to work. Yet since mid-July, testing capacity has only gone up by 10%, but the number of cases has gone up by 400%. Why did he set his target for the end of October and not the beginning of September so we could get enough tests in place?
Well, Madam Deputy Speaker, we are increasing that capacity, and as I said, it's at record levels. When it comes to her constituents, firstly, those who work in the NHS are eligible to get tests through the NHS Pillar 1 system. But all those who have symptoms of coronavirus and think they may have symptoms of coronavirus, it's very important that they self-isolate. So the point of making sure the Right Honourable Lady says she's doing that, and I'm very glad she is, and I thank her for doing that, and I hope that I'm very happy to work with the Right Honourable Lady to ensure that her constituent who works in the NHS can get a test through the NHS, because that is the role of the NHS for provision for those who work within it.
Dr. Kieran Murren.
Thank you, Madam Deputy Speaker. Can I begin by welcoming the confirmation today that Leighton Hospital will be receiving 9 million extra to help prepare for winter. I know that funding will make a huge difference. I think everyone in this House, indeed the whole country, hopes that we manage to find a vaccine, so I'd be grateful if we could get an update on vaccine development. And can my right honourable friend confirm my understanding that Test and Trace has found that actually the virus is spreading in our own homes when we're mixing with friends and family, and as much as that's difficult for us, that's why the lockdown is focusing on those types of interactions?
My honourable friend is absolutely right. Of course, as an emergency consultant himself, he knows almost more than anyone in this House about the needs of emergency care, not least because he spent lockdown working on the front line of our NHS. And I know that everybody's grateful to him for that. And so the £9 million expansion to Leighton Hospital, which he and I visited in November or December, I know that that is much needed. I hope that it brings good benefits. But it's also critical that people listen to the words that he so wisely says.
Neil Hanvey.
Thank you, Madam Deputy Speaker. On the 21st of July, during this summer's nadir of new COVID cases, I pressed the Government's Chief Medical Officer on the need to expand testing capacity. In that meeting of the Health and Social Care Committee, he stated he would not consider this until there was evidence of a new surge in cases. Now we are in the grip of a second wave with mounting chaos in testing capacity. Who should resign? The Secretary of State, the Chief Medical Officer, or do ministers in this government only resign when they refuse to break international law?
Right. There's record testing capacity that we work across the whole UK to deliver.
Sir Graham Brady.
Thank you, Madam Deputy Speaker. Can I ask my right honourable friend to set out the specific criteria that must be met for the rule of six to be lifted?
The judgment on how we lift the rule of six will be based on a whole series of measures, not least, of course, the case rate across the country, but also looking at the impact of those cases in terms of hospitalisations. Sadly, we're seeing hospitalisations starting to rise now, and we therefore have brought in measures to try to slow the spread of the virus. But we also look, of course, at the test positivity and the surveys of how many cases there are around the country, not just the total number, because of course if you put more testing in, then you get more positives. So we look at all of these indicators and of course take the clinical advice and then make a judgment.
Harry.
Madam Deputy Speaker, last time I raised the test and trace failures, the Minister accused me of not being serious. Well, I'm deadly serious. The Mildmay Testing Centre opposite my office in Ilford South has stopped accepting walk-in tests despite the constituency being on the cusp of a local lockdown, with Redbridge now having the highest infection rate in London. The Minister has repeatedly claimed to follow the science and data, whilst ignoring the advice of leading scientists who called for an expansion of our public health infrastructure. We now face further lockdowns across the country as a direct consequence of the lack of capacity in this test and trace system. It's hardly world-beating. So, with the Chief Medical Officer this saying 38,000 infections per day, can the Minister of this House confirm and give us assurance we will not need a second lockdown to mitigate against his failing test and trace system?
Well, I work very closely with the London leadership, cross-party, to tackle the problems and to ensure that there is testing available according to the clinical priority. In his own area, in the last week, there have been over 3,000 tests, and I'm sure that he welcomes those. But we absolutely work so that there's more, not least in the public health and the NHS systems, as well as in the Pillar 2 Lighthouse Lab approach.
Mark Logan.
Thank you, Madam Deputy Speaker. And I have 4 asks for the Secretary of State. Number 1 is to fix the national portal. A constituent of mine failed to get a test in Bolton. Then she tried using a Wigan postcode and succeeded in getting a test for Bolton. Number 2 is remove the backlog on testing results. People are having to wait too long before getting results. Thirdly is ramp up contact tracing. Senior leadership at my local authority informed me that they do not have the resource to deliver what is needed. And finally, what specific actions is his department taking right now to help bring down the numbers in Bolton?
Madam Deputy Speaker, the situation in Bolton is very serious, and all 4 of the requests from my honourable friend are rightly made, and he's pressing the case as he should. And I look forward to perhaps I should meet with him to see what progress we can make on all these cases.
Manjeet Singh Desi.
Thank you very much. Madam Deputy Speaker, despite the likes of me warning last month about test lab capacity problems, the government couldn't get a grip of their supposedly world-beating system and has now instructed that our testing centre in Slough should now become appointment only. The only slight snag, Madam Deputy Speaker, is that instead of being able to use the Slough site, local people are being asked to drive hundreds of miles, including getting a ferry to the Isle of Wight. This debacle is dangerous because Slough has already had too many fatalities and has only recently come off the government's COVID watch list. So how does the Secretary of State for Health, given that we all know that test, track and trace is the best weapon to tackle coronavirus, expect local communities to continue their hard work in overcoming this virus if his government is failing to provide vital resources?
On the contrary, Madam Deputy Speaker, the fact is we're working hard with the local authority in Slough, where just in the last week there have been over 1,900 tests done, and I think it would be better to work together, don't you?
Nick Fletcher.
Speaker, having visited Trinity School in the town of Thorn in my constituency, the principal told me that increasing the number of testing kits from 10 to 30 that are given to each school will better ensure that children remain in the classroom where they belong. Can my right honourable friend therefore confirm to the House whether his department is planning on increasing the number of testing kits that are distributed to educational settings?
Yes, we are looking at exactly that, and I'm very happy to talk to my honourable friend about it.
Tracy Braben.
Thank you, Madam Deputy Speaker. The Health Secretary has announced restrictions in the North East. He will know that in my community we have been under those restrictions for quite some time now. This has impacted on businesses like beauty businesses, soft play centres, wedding companies, and particularly coach companies. With my constituents doing the right thing, trying to beat this virus, but with furlough ending and winter looking like we might have continued lockdowns, can the Minister agree with me that we now need a financial package to support these businesses who are suffering so they don't wither on the vine, and so my constituents can do the right thing, having to choose between leaving work in order to keep people safe but putting food on the table? Would the Minister agree?
Well, I pay tribute to the Honourable Lady because in Kirklees it has been difficult in the last few weeks. Unfortunately, we are seeing continued cases in Kirklees. Last week, my right honourable friend, the Chief Secretary to the Treasury, announced further support for businesses. She rightly argues for that in Batley and Spen, and I'll see what I can do to further that.
I do want to re-emphasise that we do need brief questions because we have two very well subscribed debates this afternoon on coronavirus support, so it's important that we get to those fairly promptly. We now go to Tracy Crouch.
Thank you, Madam Deputy Speaker. Over the past few days, I and Kent colleagues have received a significant increase in the number of inquiries from constituents regarding testing arrangements within the county, leaving many frustrated by the online booking system and ultimately unable to arrange a test nearby. What steps is the department taking to scale up testing and lab capacity in Kent, and could consideration be given to a more accessible and localised system to ensure that those in genuine need of a test are able to arrange one as close to their home as possible?
Yeah, of course, and my honourable friend makes the point well. We're putting more localised testing in and making sure that it is as accessible as possible. And of course, the challenge is to ensure that those tests get to the right people, prioritised appropriately. And I look forward to working with my honourable friend to deliver this across Kent.
Charal Ambos.
Thank you, Madam Deputy Speaker. At least 6 care homes in my borough of Enfield have seen a return of COVID-19 cases. At the same time, they're experiencing delays in receiving Pillar 1 and Pillar 2 test kits and results, and results taking more than a week to arrive, potentially leading to a rise in the spread of the virus. So can the Minister tell me what steps he's taken to ensure that testing isn't taking as long, and what he intends to do to fix this mess?
Making sure test kits get returned rapidly is incredibly important, including in social care. I'm glad to say that backlog has come down over the last week, we at its core, our response to the problems in social care, because so many people who live in older age care homes are so vulnerable to this crisis, is to protect the amount of test kits going. And so the weekly testing of staff and the monthly testing of residents has been delivered and is being protected, even despite all the other pressures on the testing capacity.
Becky Barty.
Thank you, Madam Deputy Speaker. Can I thank my right honourable friend for all the work he's doing in some clearly challenging circumstances. My constituency of Meriden, which is part of Solihull Borough, is in enhanced restrictions at the moment, restricting household-to-household mixing. Which is absolutely the right thing to do. Will my right honourable friend give consideration, however, to informal childcare arrangements being allowed for many parents who can't afford to pay for childcare, who will welcome the opportunity to go to work within the guidelines and also have childcare in place?
This is an important question, and it's a very difficult balance, because often informal childcare is of grandparents looking after children, and of course older people are the most vulnerable to the disease. So that's the balance that we need to strike, and I always keep an open mind. I'd be very happy to talk to my honourable friend about getting this balance exactly right in his area.
Margaret Ferrier.
Madam Deputy Speaker, the Government's plans for mass testing have been criticised for placing their faith in technologies that are yet to be fully validated scientifically. And the Prime Minister himself acknowledged that we are some way off from widespread use of pregnancy-style COVID-19 tests. Given the well-documented issues with capacity in the UK testing system at the moment, would the Health Secretary accept that we need to focus on ensuring the existing system works before trying to shoot for the moon?
Madam Deputy Speaker, we need to do both, and I would just ask the Honourable Lady, for instance, to look at the work that the SNP Scottish Government is doing, who themselves are employing and deploying some of the new technologies.
Chris Green.
Thank you, Madam Deputy Speaker. In Bolton, the national lockdown has been followed by the local lockdown, which has been followed by the economic lockdown, and we have seen positive COVID test cases rocketing up. This is having a devastating impact on people's physical and mental health, and also people's livelihoods and businesses. Many people also are heading out of the borough to get their beauty treatments, to go to the pubs and restaurants. At the same time, the testing system is failing to deliver, so people are increasingly going to accident and emergency in Bolton and Wigan in the hope of getting a COVID test. What actions is my right honourable friend taking to deal with this?
Well, we have put huge amounts of testing into Bolton, over almost 7,000 over the last week. People should not go to A&E to access a test. I've seen that that's was being reported yesterday, and my team have been working with the hospital, who are doing a very good job in difficult circumstances. They themselves are seeing the number of hospital admissions with coronavirus starting to rise. And I just pay tribute to my honourable friend, because the situation in Bolton is very difficult, with over 200 cases per 100,000 population, the highest in the country by a long, long way. And we've got a lot of work to do to get the situation under control in Bolton, and all the people of Bolton should listen to the public health advice, unanimous amongst the MP representatives, the council, who are doing an excellent job, and the national clinical advisors, the same advice, which is do not socialise with those outside your household, and that way we'll be able to get this most localised of epidemics under control.
Listen.
It's no good blaming the public. People want to know that they can get a test when they need to. 25% of new cases are in the northwest of England, but only 15% of testing capacity. My constituents who are showing symptoms cannot get a test. Children and staff in our schools need to be able to get a test so schools can stay open safely. Our care homes in my borough are worried that as demand goes up, they won't be able to get a test either. So when is the extra capacity going to be available in my constituency? The British people know what is going to happen and who is responsible. Fix it.
Madam Deputy Speaker, in Sefton, we have been putting in the extra testing capacity. Over 5,000 tests were conducted in Sefton in the last week. And that means that people should hear loud and clear that if you're in Sefton, as anywhere else, if you have the symptoms, come forward. But his question, rightly raising the importance of people with symptoms and people in care homes being able to get a test, also underlines the point of how important prioritisation is, and people who don't have symptoms not coming forward. And I hope that he would repeat that message as well.
Thank you, Madam Deputy Speaker. Having visited Chorley and South Ribble Hospital last Friday, I was delighted to see some of the government's £300 million grant in action. The team's on the ground building significant works to help make the A&E unit more COVID secure and increase its capacity. Could my right honourable friend join me in looking forward as soon as possible to its full reopening?
Yes, absolutely. As I mentioned in my statement, I want to see the A&E reopening as soon as is safely possible in Chorley. She's right that we've put in a huge amount of support, and we all want to see that happening. I look forward to it and the day, I hope soon, when we can announce that that's happened.
Thank you, Madam Deputy Speaker. As my constituency of Blaydon sees the introduction of the new local restrictions in the North East, will the government please give some extra thought to easing the restrictions on informal childcare? Informal childcare is an important part of the North East economy and an absolute necessity for those on the lowest incomes, and in particular for women. I understand it's something that the local authorities have also requested. So will he think about that again for the North East?
We work with the honourable lady on this question. It is a challenge because of the problem of intergenerational transmission of the virus. I'm sure she understands that side of it as well, and so it's an important balance that we need to strike.
David Amos.
I'm absolutely delighted with the £9.7 million upgrade of Southend A&E, which is entirely appropriate as we move towards city status. But would my right honourable friend agree with me that if Southend is to avoid a lockdown, we cannot have a repetition of the scenes seen at Short Street testing station yesterday, where apparently someone in management said you could turn up without an appointment?
I'll happily look into the testing in Southend, but it is nice to have some good news for the people of Southend today.
Rachel Hopkins.
Thank
Madam Deputy Speaker, Luton was an area of concern earlier in the summer, but we came out of it because we were able to get tested whether you had symptoms or you didn't have symptoms. However, now, with the prioritisation to only those with symptoms because of the abject failure of the government to get the testing process right, means that Luton residents in my constituency of Luton South are really worried that we're just going to see the simple, blunt tool of a national lockdown. Can you give some clarification?
Well, the Honourable Lady is absolutely right that in Luton is an example of local action that worked to bring the case rate right down. The outbreak was very specific to certain parts of Luton. The council worked with the national bodies brilliantly. Now, of course, over the last week in Luton, there have been around 3,000 tests done. So those tests are there available, and I look forward to working with her to make sure that people who have the symptoms are able to get the test.
The Luton and Dunstable Hospital, which the Secretary of State has announced today. And does the Secretary of State agree that it would help people with symptoms who do need a test if those told to self-isolate without symptoms don't think a test is a get-out-of-jail-free card? And how can we help people to self-isolate properly, given only 1 in 5 have been doing so?
This is the absolutely central point, which is that if you don't have symptoms, but you've been close to somebody who has tested positive or has symptoms of coronavirus, unfortunately, because of the biology of the virus, because it incubates for a number of days and can be for up to 14 days, you have to self-isolate, and then even a negative test doesn't release you from that obligation because you may well get a false negative. That is at the core of how we control this virus. And the more that colleagues around this House can explain this principle, it will both relieve pressure on the testing system and help to break the chains of transmission of the virus, and is an incredibly important point for us to communicate to all those who we serve.
Pascal.
Thank you, Madam Deputy Speaker. In PCU we have a health secretary out of control, of a virus out of control. Next weekend, we've got 40,000 students coming to York. We were promised a testing centre next month. It's now not going to be until at least November until we can get a walk-in centre for people to have a test. What discussions has the Health Secretary had with his colleague in Defence about strategic planning? Because it seems that his department are incapable of planning for this virus.
We, of course, do have to ensure that the provision of the testing centres is where the virus is most virulent. And so we do have military planners involved in that process, and it's a very important process to get right. I should also say, Madam Deputy Speaker, that we've just had 2 speakers from Luton, and I forgot to mention the money to improve Luton Hospital, which is one of the best hospitals in the country, and I'm delighted that they've been able to make the case successfully for the expansion of their A&E, which will serve all the people of Luton.
Sir Desmond Swain.
1.4% of those 275,000 people who travelled and queued were positive. Won't even a modest number of false positives mislead us? And is the ONS survey any less prone to false positives?
My right honourable friend raises an important point about the mathematics and the science of testing. And I'm sure that he'll enjoy reading the annexes to the ONS report, which comes out each Friday, which addresses directly the question of how they adjust for potential false positives due to the high but not perfect specificity of the PCR test. I'm very happy for one of my academics to take him through the rigorous Bayesian mathematics, which I'm sure will help to elucidate the debate on this still further.
Caroline Lucas.
Thank you, Madam Deputy Speaker. Because of the testing shambles, I understand that COVID tests now have to be rationed to high-risk areas. But at a time of increasing case numbers in Brighton and Hove, a yellow alert has just been issued amid record cases last week. How will new outbreaks in currently deprioritised areas be identified and contained if we're not testing in the community properly? How will contact tracing function? I'm really worried about the impact of rationing tests on the chances of knowing about containing new outbreaks in other regions. And while I have the floor, could I just ask him to condemn the comments of the Leader of the House about an hour ago when he told the public to stop their endless carping about lack of access to tests. It's not endless carping. What it is genuine concern about people's health.
Madam Deputy Speaker, given the Honourable Lady's understandable concerns for her constituents, she should welcome the record capacity of testing that we have and the over 3,000 tests that have been done in Brighton in the last week.
Jason McCartney.
Thank you, Madam Deputy Speaker. With speculation about new local restrictions for West Yorkshire, will the Secretary of State reassure me he will continue to be driven by the data, but will he also deploy extra testing facilities and capacity, because entire families in my constituency are unable to go to work or school as they sit at home repeatedly refreshing the testing portal trying to book a COVID test for family members with symptoms?
Well, my honourable friend who raised this issue with me on Tuesday, quite rightly, knows that I will always be driven by the data in the question of the local action that we take. And where we do take local action, I do that with a heavy heart. I was very pleased that we were able to take his constituency out of the local action in West Yorkshire. However, we have seen case rates go up, and we will be guided by that data, and I look forward to talking to him and working with him on that basis.
Catherine McKinnell.
Thank you, Madam Deputy Speaker. Despite the disappointing news that the Health Secretary has delivered, I know the people of the North East are committed to doing everything they can to get this virus under control, but the government needs to meet them halfway. In Scotland and Wales, children under 11 are exempt from the restrictions. That enables families to be able to get to work who do not have an army of nannies and formal childcare. I appreciate the concerns he's outlined today, but none of them explain why the people of Scotland and Wales are trusted to make these decisions, yet the people in England are disproportionately put in a difficult position of not being able to rely on family and friends.
Can I pay tribute to the Honourable Lady, who has in her in what she's been saying this morning and overnight around the restrictions that unfortunately we've had to put in place in her local area, has been speaking for her constituents and with very clear public health messages that it's so important that people heed. I'll absolutely look at the point that she raised and make sure, working with her local councils, that we get the details right of exactly the measures that are put in place in her area and indeed across the country.
Davison.
Thank you, Madam Deputy Speaker. And as a North East Tory MP, I'm grateful to my right honourable friend for engaging so effectively with our local authorities in the North East as we try and tackle this really worrying rising cases. But I am concerned that residents across my constituency are facing these difficult restrictive measures, yet without seeing many COVID cases rise in our local communities. So can I ask my right honourable friend how he will review the situation in the North East and ask whether he'll work with me to assess the figures at the most local level to ensure that residents from Spennymoor to Shildon to Barnard Castle can all get back to normal life as soon as possible?
Yes, of course. We take action. We take action at as a local level as possible. But unfortunately, we do have to take action in this case. I myself was in the North East on Monday, and I'd echo her comments that people will do what is necessary to control this virus and to look out for their communities. And I pay tribute to the work that she's done representing people from Bishop Auckland and her whole constituency in what are difficult times.
Kevan Jones.
Thank you, Madam Speaker. Many of my constituents in North Durham can't get tests, including people who work for the NHS. Others have been sent as far afield as Aberdeen for tests. At the same time, there's been spare testing capacity in the region. And last week, NHS Test and Trace moved out of County Durham all their mobile testing units. Now, the measures that he's outlined today, I agree with my honourable friend from Newcastle North, will be enacted by the people of the North East. But unless we have an effective local test and trace system, they will not work. Is it not time to just admit the national system has failed and the effort now has got to go on to Directors of Public Health and they're given their finance locally to put in place effective test and trace which local people can have confidence in.
The test and trace system works in combination of the national and the local. And if you took away the national, then we wouldn't have the record testing capacity. But if you took away the local, then you wouldn't have the local knowledge and the boots on the ground who can solve problems and find people who need to self-isolate. It's the combination of the two that works. And I would urge the honourable gentleman, the right honourable gentleman, to work with his local council and with the national teams to do everything we can to get the virus under control in his area.
Point of order, Munira Wilson.
Deputy Speaker, during the Secretary of State's response to me earlier in the statement, he said that I was wrong to raise the issue that I did earlier this week of my constituents using Scottish postcodes to access tests, and that I wasn't being fair or straight with my constituents. I would like to offer the Secretary of State the evidence that I have. I have emails from Sunday, from Monday, and indeed this morning of constituents using Aberdeen and Dundee postcodes to then access tests at the Twickenham site. So could I ask whether the Secretary of State will withdraw his comment, or is he suggesting that my constituents are lying to me?
Madam Deputy Speaker, on a point of order, I'm very happy to look at any evidence that's presented, but I did look into this issue because when it was raised on Tuesday, and if somebody does, as she suggests, then when you go to the testing site that isn't the one you booked into, it comes up as an alarm on the screen to say this person is booked into the wrong testing centre, and so there is a process in place to tackle the problem that she mentioned, and I'm very happy to look at any evidence to solve any problems in the system, but I'm afraid I have looked into this one, and I'm assured that that's the case.
Well, I thank the Honourable Lady for her point of order, and I thank the Secretary of State for responding to it. What I suggest is that if the Honourable Lady still thinks there are emails that she wishes to send to the Secretary of State, that perhaps she does so, and it feels as though we can perhaps get to the bottom of this if we do it that way. Thank you. Order, 3-minute suspension. Thank you.